welcome to this special episode on kidney stones. With me, Dr. Stacey Fernandez. In the studio with me is Dr. Ritvij Patankar. He is a consultant urologist at RG Hospital, Porvorim. He has done his MBBS, MS in General Surgery, and MCH in Urology. Dr. Ritvij, welcome to the show.
Good evening and thank you.
Yes. So, doctor, what exactly are kidney stones? How are they formed? And, what is the science behind all of it?
So, kidney stones are basically these hard mineral deposits
Right.
of various minerals, acid salts that are usually formed in concentrated urine. So, कशें आसता जेन्ना urine जी आहा ती चड concentrated येता just because of multiple reasons. Say for example, most common is dehydration. The various dissolved salts जे तातून आसता तर त्या saltsची deposition जावपाची सुरवात जाता. And these small deposits, they tend to harden and slowly form a nuclei over which अजून चड असे deposit जाऊन finally we get what we called as a kidney stone.
Right. So kidney stones are of different types. म्हणजे खूप तऱ्हेचे असतात किडनी स्टोन्स काय लाईक एकाच तऱ्हेचे एकाच मिनरलचे डिपॉझिट्स किडनी स्टोन असतात.
No, the kidney stones are of various different types. One of the most common ones are the calcium, monohydrate and calcium dihydrate oxalate stones. So
Right.
these are some of the most common stones. Apart from that, we may have what we call as uric acid stones. Apart from this, we have struite or the infection related stones. We have some rare stones like cystine stones or xanthine stones. So, अशे पळोवंक गेले तर there are many varieties of stones. Yes, what we do commonly see is there are certain regions which may show particular type of stones that are little bit more commonly formed. For example, Goyan, we have a little bit higher incidence of uric acid stones.
Right.
Those are because of certain peculiar conditions that we see here.
So what are the reasons that we have higher incidence of uric acid stones in Goa?
So for that we need to understand the science behind formation of various stones. For example, आता calcium oxalate stones जर पाहिले तर whenever dietary oxalate जी quantities असता
Right.
ती चड जाता. Coupled with that, say you are having dietary calcium which is deficient. Oxalate tends to get
Pile up.
concentrate. Yeah. It tends to get pile up, and this particular piled up oxalate will then start depositing. You start getting calcium oxalate stones. Tashes uric acid stones, they are more commonly seen where incidence of high meat, particularly animal meat protein that is being consumed, is on a higher side. Such regions are more common to have uric acid stones. So in Goa we have
Yeah.
peculiar like dietary habits are more prone to red meats
yes.
and these dietary habits. So we see more of the uric acid stones in our region.
Right. So doctor, where in the kidney system do the actual stones form?
So the most common part where the stones are formed is the kidney itself. So kidney चे भितर कशें आसता, there is a filtration system, and at this particular filtration system the urine is formed. So there are multiple theories wherein the renal papillae, the papillary system, wherein the finally urine will be formed and start collecting in the renal pelvis. So these peculiar areas are known wherein the initial what you can say the small calcific deposits they occur, and finally the deposit jenna it achieves a particular size. This particular deposit then forms the kidney stone.
Right.
One more region wherein primary stone that can be formed in the urinary system is the urinary bladder. So bladder system अशें आहा की normally bladder tends to get full and it empties.
Right.
If there is any particular problem with the emptying of the bladder wherein मुताच्या पोतीन चड urine बी उरता अशें जर जालें, then because of this particular stasis, stones can then form in the urinary bladder themselves also.
Right. Doctor, now in your practice, Goa is, of course, a small state. Do you see any regions which are endemic to certain kind of stones?
In Goa, Kankon area is particularly because we
Yes.
have seen over past few years of my practice that yes, that particularly people from Kankon area are more exposed, to have stones, recurrent stones,
Yeah.
stones at younger age. What are the reasons for which Kankon peculiarly forms, this high stone-related cases? That requires, of course, further study. But yes, it can be studied
We
in
studied
future. Yeah.
it. Right. But doctor, do you think like we have diabetes or heart disease, which is has a hereditary angle to it? Do you think kidney stones could also be hereditary? म्हणजे तुझ्या बापायक आवयक आसत जाल्यार तुकाय येवपाची शक्यता आसता, or is it not?
Yes, yes. So, if I have to list various reasons की जेका लागून stones जाता, so gender is considered one of the risk factors.
Right.
Men having more tendency to forming kidney stones. Apart from that, genetics, yeah. For example, there are certain Gujarati, Sindhi communities wherein the stone formation is, this much
Is it
more,
higher?
yes, much more than, other comparable populations. So, genetics do play a role. Apart from that, your diet, what your diet is rich in, whether that particular factor is prone to forming stone. For example, meat can give rise to uric acid stones.
Right.
So we have that as one factor. Apart from this, environment plays a very important factor. So if your environment is more prone to dehydration, then and coupled with that you are in a job which exposes you to outdoor environment or certain occupations wherein exposure to furnaces and higher temperatures are there, then in such conditions stone
You can
formation
develop.
is at a risk. One more factor which very rarely is discussed about, the role of diabetes and metabolic diseases. It has been seen that obesity, diabetes, the diseases that have a role or which change
Affect
your
your metabolism.
metabolism, yes, these people tend to have more stone. India, as it is, that we are a
Yes.
global diabetic
Yes. Yes.
capital, so we are more prone to forming stones. And the worst part about kidney stones is it is a recurrent disease. So it is not that
It's not that
if
once
I
you
can no
cure,
if I
it's done.
can cure your one stone, that doesn't by default give you an immunity to further stone formation. It's
Right.
not like that. Rather, if you have formed stone even once, your chances of having a second stone increases by nearly 30 to 50%.
Correct.
So that itself should make us aware that how recurrent the disease is.
Right. So I could safely say that kidney stones is also a lifestyle disease. I mean,
Yes.
with all the other factors that you have said,
Yes.
our lifestyle also contributes in a large way to developing
In a
kidney
very
stones.
large way, yes.
Right?
You have, I think, exactly caught the main point of this particular discussion.
Right. Yes, yes, doctor. So let's come to the symptoms of kidney stones. How would a patient present with, kidney stones?
So, most common symptom, if you talk about, everybody knows, is pain, and it is one of the horrific pains that you can
Yeah,
face.
they say it's almost equal to labor pain.
Yes, 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 exactly. So, and it's a colicky kind of pain. Colic
Right.
म्हणजे कशें असता की the pain suddenly it comes as a clinching, cramping type of pain,
Right.
and then it will relieve over a little time. Again, the intensity comes. So this is called as colic, and this pain is most common symptom that everybody is aware about.
Presents.
Second most common symptom is this pain can be a radiating nature. Radiating म्हणजे कशा तर it can start somewhere up here in the loin region, and then it has a tendency to go cross towards the groin region. So we call it radiating
Loin
type
to
of
groin
pain.
pain.
Apart from pain, what patient usually present are various urinary symptoms. आता urinary symptom म्हणजे कशा तर some people may have slight blood tinged urine. They may present with that mild hematuria. Some patients may have a burning desire, of micturition. Some people may have that feeling, of you get the feeling to pass urine, but then when they go to pass urine, nothing comes out. Strangury kind of symptoms. These are also
You're
no.
not
So
satisfied when you're going to pass urine.
yeah, so these symptoms basically are related to where exactly your stone is and
Right.
what it is causing. If your stone is present within kidney, you may find pain because of the expansion of or pressure on the renal capsule. So you may get a dull aching pain that is usually at the backside on the renal angle. As it starts traversing down in the ureter, then you start shifting this, the pain increases, the nature of the pain and intensity of pain increases, the other symptoms, urinary symptoms and this dysuria, strangury, these usually tend to come into play. समजा जर फातरक्यांना मुताच्या पोती आयला, suddenly the patient may get retention of urine, because then it can block the passage of urine. So depending upon where the site the stone is and what it is causing, the symptoms changes. Fever and chills are one of the symptoms, wherein whenever there is an infection in the system, the patient may present with these kind of symptoms too. And nausea, vomiting, that we should not forget. Acute pain, will give you sudden feeling of that nausea, and multiple episodes of vomiting can occur.
Yes.
So these are the various
these are like
symptoms.
broadly the symptoms which we have in kidney stones. Not necessarily everybody has to present with same things.
True.
And some might not present at all. But more or less, these are the symptoms that a patient will present with.
Yes.
So, doctor, moving on, how would you diagnose, kidney stones? Because we are in an era where patients think doctors order useless number of tests, but sometimes those tests are actually needed for, identifying the disease and treating it and planning the modality of treatment. So, how would you diagnose kidney stones with the help of tests?
So, the one of the most common tests that I think everyone these days will be aware of is a sonography, or USG or ultrasound. So in urology, the dictum goes that sonography nowadays we do not consider it as a investigation modality. It is rather an extended clinical examination. Right? Why? Because it serves the same purpose of giving us a clinical examination and getting a clinch of that understanding of that diagnosis. So this is one of the most common modality, by which a stone can be diagnosed. But it is not the only modality that your doctor or your urologist may ask you to do.
Right.
Certain blood tests are very much important. One will be your, a complete blood picture, wherein if you are having acute symptoms, we need to know whether there is any infection present or not. That is one. Second is your renal function test, like urea and creatinine. These gives us a picture of what the kidney is going through right now. If it is subjected to any acute kidney injury, wherein the creatinine may rise. Urine tests are important. Your blood sugar levels are important. This is because on an average, you never know who is a diabetic person or who is not a diabetic person. So knowing the blood sugars also play an important role. So all in all, these are the usual tests. Once your sonography has been done, your doctor may then take a decision to go ahead with a CT scan.
Right.
Now you may ask, you have yeah. So like if you have a sonography, why again, what's the need of getting a CT scan? So sonography is a subjective test. It always gives us the basis, of probing further. However, we need an objective test to go on whether, whenever we are going to decide whether we are going to intervene or we are not going to intervene. So for that, a CT scan do play an important role.
Doctor, moving on to the treatment. How would you treat kidney stones? Would it be purely a surgical approach or just a medical approach or both? How would you just go about it?
So to tell you, there are both medical line of therapy as well, surgical line of therapy as well, that is utilized when we manage the kidney stones. Broadly speaking, any treatment depends upon a few factors. For example, what are your presenting symptoms? What is the, if it is because of kidney stone or no? If it is because of the kidney stone, then what is the location of the stone? What is the size of the stone? whether your stone is obstructing the system or whether it is not obstructing the system. So like this, various factors are involved. Supposedly, we come to the conclusion that we require a medical line of therapy. Earlier, you must have heard that people used to admit the patient, start on saline, give ample amount of water,
Right.
give some diuretics and all.
Yeah, like classics and all.
Yes. So these used to be called as forced diuresis. Nowadays, this has become obsolete because it can also has its own side effect wherein kidney may go into acute kidney injury.
Right.
So what do we nowadays follow? What we follow is called as a medical expulsive therapy, wherein there are certain drugs like you may have heard tamsulosin, which is an alpha blocker, or calcium channel blockers. So like some steroids. So there are certain drugs that your doctor may consider utilizing for the expulsion of the stone. So what these basically do is they tend to relax the ureter or anywhere where the stone has come and obstructed.
Yes.
And if the stone is of passable size, we expect that the stone should pass off. So broadly speaking, nowadays medical expulsive therapy is what primarily used for an obstructing but passable stone.
Right.
If your stone is a non-obstructive stone, if they are small, they are non-obstructing, we can give them a chance of dissolution therapy, wherein we may use certain medicines. The most commonly used are an alkalizers.
Right.
And we can see if these particular stones can either decrease in size, or if they are small, they can decrease and thereby pass off in the urine. When it comes to surgery, there are what we call non-invasive procedures,
Right.
and there are
Invasive
invasive
procedures.
procedures. These depend upon where the stone is again present, its location basically, and its size. In case of kidneys, the non-invasive procedure that is most commonly employed for smaller stones is what we called as ESWL, wherein
Right.
sound waves are used
Okay.
to they are focused on these particular stones, and thereby the stones are broken. So for the kidney stone, what other things that we can do is, initially, if not ESWL, the other modality that was available to us, which was minimally invasive, was PCNL. So by PCNL, what do we mean is, from outside of the body,
Right.
we would make a track,
Okay.
and by this particular track we will enter the kidney, and through a camera we will then see the stone and break it with a lithotripta machine.
Right.
And take the fragments out. This used to be called as PCNL.
So ये दोन्ही procedure is only for the stones in the kidneys.
हाँ, हे दोन्ही procedures are, these are for the stones in the kidney. Usually up to a centimeter stones एका ESWL use करू शकता. आणि a centimeter plus the stones आशिल्ले तर तेका at least in prior PCNL use asli. Anything bigger or larger stones, open surgeries used to be employed. Now we have something called as RIRS. So at the current moment, if I have to use a minimally invasive but the most advanced technique to manage kidney stone, so then what I can use is called as RIRS. Currently this is the most advanced, but among one of the least invasive methods for managing kidney stone. So what exactly is RIRS? RIRS, the full form of it is retrograde intrarenal surgery for kidney stones.
Right.
So retrograde म्हणजे किती तर मुताची जी वाट असता. So from the exterior, from a natural urinary passage, we pass a flexible scope. So flexible scope म्हणजे just
Which is
like a
movable.
tube.
Yes.
So not only movable, foldable as well.
Yeah.
So such a scope is passed right up to the kidney. आणि ते डायरेक्टली किडनीचे भितर पावता. किडनीचे भितर पावल्या उपरांत we have an access now to the entire interior of the kidney, the various small pockets.
Right.
किडनीचा जो फिल्टर असता इट इज डिवायडेड इंटू मल्टिपल स्मॉल स्मॉल एरियाज विच आर कॉल्ड एज कलायसिस. सो हे किडनीचे भितूर स्कोप धाडून बाबा we can use laser fiber, and laser fiber can be used to break the stone into very smaller fragments, and those that cannot be removed they can be easily powdered as well.
Right.
So this is called as RIRS. However, there are a few what you can say contraindications to the procedure as well. For example, the size of the stone matters. Usually RIRS is employed when the size of the stone is up to 1.5 centimeter maximally. The kidney should not have any active infection ongoing. So after managing all of these things, your doctor can advise you to undergo RIRS. The best part of RIRS is you need not have to have now a hole on the kidney.
Right. Your kidney is not damaged per se.
Yeah.
As
So
in, it's not
yes.
cut open.
So
and the stone-
rather than cut open, even in PCNL, we used to have to enter through the body of the kidney. So therein
doesn't
that
happen
trauma
in this.
used to be
Yes,
there.
yes.
This is the least traumatic because we are not cutting the kidney in any
Anyway,
manners.
yes.
Yes. So this is what we can employ for the kidney stones.
Alright. So, doctor, once the stone is removed from the patient, what do? Do you discard it, or is it given back to the patient, or is there some test done on the stone?
So that's a nice thing. We usually tend to give the fragments back to the patient.
Yes.
And these particular fragments can be tested. So तुम्ही जर तुमचं स्टोन टेस्ट केला तर तुमका हे समजता की what exactly is the makeup of that particular stone. Makeup in the mineral makeup of the stone. So if you know की बाबा म्हणजे स्टोनाचे भितर किती minerals आहात, I know how indirectly how that stone may be forming within me, and then I can particularly direct my efforts to managing my diet, managing the various medications that are required for better management of the preventive, what you can say, the medications for preventing the recurrence of stone.
Yes. So, doctor, now we've understood the facts of kidney stones. Now I'll go to the other segment of today's episode, the myths involved in kidney stones. So, the first and most commonest being is drinking large amounts of water can flush out the stone. Many people get up the first thing in the morning, they get up and they drink water therapy. So does that really help? Is there any role of that in treating kidney stones?
This is one of the most common myths. Like people think that drinking large amount of water means I'll be waking up in the morning having a liter of water, and there are people who drink nearly a liter of water the moment they wake up, and then rest of the day they won't be minding their water at all.
Yes.
So it's not like that. Body जी हाँ ती urine continuous बनाता. It's not like it will be preparing urine in particular timely manner. If the body is preparing urine continuously, it do requires water as well in a continuous manner. So continuous manner means we should be having little amount of water throughout the course of our day, rather than binging on water in just one go, and then dehydrating ourselves or not minding our water intake for hours together.
Right.
So this is not going to help.
Right.
This is a common myth.
Right. So what is the acceptable amount of water that you should drink in a day?
On an average, in an environment like Goa, for a healthy person, approximately 2.5 to 3 liters of water per day is sufficient. We can tend to increase it if we are exposed to dehydration.
Right. So, doctor, once you have kidney stones, does it mean you're not going to have stones again? Or will there be a recurrence, and what are the prophylaxis somebody needs to take?
So, if you are going to ask me that if you have a kidney stone and if your stone has been removed, does it make you permanently stone free? Na, tashi na. Kidney stone is a recurrent disease. Like I said earlier, you have nearly 30 to 50% of risk to have a second stone once you already have formed a stone. So in this particular case, if your doctor treats your kidney stone, that doesn't mean that you are off the hook.
So, doctor, in case of ureteric stones, a lot of patients continue taking dissolving therapy, or they think that dissolving therapy can be used for all kinds of kidney stones. What do you think is your take on this?
No, this is another, I won't call it a myth, but little misconception. So, usually dissolving therapy can be used for stones that are not obstructing your system. पण जेन्ना स्टोन किडनीसून सकल शिरकोवन बाबा युरेटर म्हणजे किडनीची जी युरीन कॅरी करपाची ट्यूब आसता ती ब्लॉक करता देन रिमुवींग द ब्लॉकेज इज द प्रायमरी मोडॅलिटी ऑफ ट्रीटमेंट. I won't be waiting there to dissolve your stone. My
Right.
primary concern will be opening the blockage because ureter म्हणजे ट्यूब जेन्ना ब्लॉक जाता or there is any blockage in the kidneys urinary system, back pressure जी हा that will start
Kidney
acting.
मारून येता.
Yes. आणि if you keep it just like that, even kidney पिड्यार जावपाची शक्यता उरता. So we should know that what therapy we are taking, it is in consultation with the doctor.
Right.
And not just because I have heard about it from
Or just some
somewhere
over-counter
or it has worked for
medications.
some other person so it
So
may
it'll work
work
for
in
me.
me. It's not
Right.
like that.
Right. Another thing, doctor, like people know that they have kidney stones, but it's not troubling them. They're not having pain. They're not having problem passing urine, so they won't take the medications. Is that what you advise the patients, or how do you want to
No,
go about
this is one more thing. If your stone is giving you symptom, at least it's a blessing that you are having a problem.
Right.
If your stones are silent, I think you should be more
Worried.
vigilant
Yes.
over it, because people tend to think की हांवें बाबा वगत सुरू केलें आनी म्हाका पेन जाय आशिल्ली आनी आतां हांव वखतारां आनी म्हाजें पेन गेलें सो म्हाजो किडनी स्टोन ट्रीट जालो. It's not like that. You have to be vigilant whether your kidney stone is silently blocking your kidney. Your blocked kidney is not giving you trouble. That doesn't mean your stone has been treated. That simply means that now the kidney is not giving you signal that it is still in problem. It is a more dire situation wherein you should visit your doctor, monitor yourself and get the stone treated.
Doctor, we had a great discussion, and I am sure our viewers are better educated on kidney stones and how to identify if you have, and how to treat them, and how to prevent them as well. But as we come towards the end of this episode, I would like to ask you just to give our viewers a take home message, because they say prevention is better than cure. So, what would you like to tell our viewers towards the end as a take home message to prevent kidney stones?
Certainly. In particularly with the kidney stones, what I feel is patient education and your general awareness and knowledge is the key cornerstone for the treatment. Reason being is I can treat your stones that are causing you problem. There is no way right now, unfortunately, I have a medicine to prevent your stones permanently.
Right.
So I am dependent on my patients to follow a good what you say lifestyle, because it's finally a lifestyle related disease as well. So patient awareness, patient education, it does have an important role. That's all.
Yeah.
Yeah.
Thank you so much, doctor, for sharing your views. Thank you for watching this episode. Take care and keep watching Prudent.